Hi all. In this video we're going to see about the examination of cranial nerves 1 to 6. So we know that there are 12 cranial nerves in our body and examination of cranial nerves is a part of the physiology practical exam. So in this video we'll be seeing the first half, which is 1 to 6 cranial nerves and how to examine them. So let's get started. We know that our first cranial nerve is the olfactory nerve, and olfactory nerve is meant for smell. So how do we test that? Obviously by asking the subject to smell something. So there are some important things we have to ensure before examining the olfactory nerve. First one is that we have to exclude any nasal condition, and then you have to ask the subject to close his eyes and close one nostril with his finger, like this. You have to close the eyes and close one nostril with a finger. And then we have to bring the bottle which is containing any odorant. It could be coffee, it can be asphyxiated, anything, near the open nostril, and ask him to identify the substance. And the test must be done on the other side, but this time with another odorant. So remember to use two different smell for each nostril. Otherwise the person will be able to guess what the smell is. So that's how you'll test for olfactory nerve. Next is the second cranial nerve, which is the optic nerve. So we know that optic nerve is a sensory nerve which is mainly involved in vision. So to assess the optic nerve, we have to assess their visual acuity, visual field and color vision. So how do we test that? So first we'll see how to test for the visual acuity. So for visual acuity, we've got, for distant vision we use a special chart which is called the Snellen's chart. So this is the Snellen's chart here. Now to test the visual acuity of distant vision, we ask the subject to sit at least 6 meters from the chart in a well-lit room. And then you ask him to cover one eye and read the chart letters from top to bottom. And we have to note the lowest row which is read correctly. Now if the person is using spectacles, it is ideal to repeat it with and without them. That means even without the spectacles you can ask the subject to repeat it. Now, one thing you have to remember is, why do we need this Snellen's chart, or what are these numbers present here? See, the formula for visual acuity is distance from the chart divided by distance letters read by a person with normal vision. So this 60, 36, 24, 18 are the distance at which the letters can be read with a person with normal vision. So for example, this big A can be read by a person who is 60 meters away, provided he's got a normal vision. Okay, so that is the formula. So now you can guess at what is the distance at which we asked a person to sit. It was 6 meters, right? So 6 by distance the a normal person can read. So suppose the subject was able to read till this HOTV. That means his visual acuity is 6 by 12, because this HOTV can be read by a person with normal vision at around 12 meters. Okay, so which means a normal person can read this line, that is the last line, at 6 meters. So that is why we say that the normal visual acuity is 6 by 6. So now I hope you got the concept of what these numbers behind this are and what the formula for visual acuity is. Now, if the person has a visual acuity less than 6 by 60, which means even by sitting at 6 meters, he is not able to read this A. Okay, then what will we do? We have to ask the subject to move closer to the chart until the top row is readable. So, for example, if he can read it at 5 meters, then his visual acuity is 5 by 60. Suppose he can read it only at 3 meters, then his vision is 3 by 60, and so on. Now suppose the visual acuity is less than even 1 by 60. So even at 1 meter the person cannot read this A. Then what will we do? Then we can test by counting fingers at 1 meter. You can show a number or show some fingers in front of at around 1 meters and ask the subject to count the number of fingers. You can show a 3 or a 4 or any number of fingers and ask him to count at 1 meter. Now if he is not able to even count the fingers, you can ask the subject to ask the subject whether he can perceive a hand movement. You can just move the hand and ask him whether he can perceive that hand movement. If that is also not possible, you can ask him, you can shine a torchlight and ask if he can see the light, that is perception of light. Now if perception of light is also negative, it just indicates complete blindness. Okay, so these are the different steps by which you can test for distant vision. Next, we'll move on to the near vision. So for near vision, we use this chart which is called the Jaeger's chart. So as you can see, there are many lines which are written in different font size. So we ask a person to read this Jaeger's chart at around by holding it around at 30 centimeters, which is our usual reading distance. And if the subject usually requires them, the reading spectacles can be worn. And then what we're going to check is the smallest type that can be read comfortably is noted. So the normal line that a person can normally read is N5, which is somewhere here. Okay, this is the normal font which a person can read comfortably. So that is the normal near vision, which is N5. Now the next test for assessing the optic nerve is a visual field. So how do you test for visual field? So for that we've got a test called the confrontation test. So how do we do it? We ask the subject to sit at least at a distance of 1 meter, and then you have to test each eye separately. So the basic procedure is you ask the subject to cover his left eye with the left hand. See, like this. Ask the subject to cover the left eye with the left hand, and the examiner will be covering the corresponding eye, which means the examiner's right eye. Okay. And then you can ask the subject to look directly onto the examiner's left eye. So see, like this. The corresponding eyes should look at each other. Okay. And you have to ask the subject not to shift his gaze to anywhere else. Just stare at the examiner's corresponding eye. Okay. And then what you do is you extend your arm. See, the examiner has to extend the arm fully midway between the examiner and the subject. So remember, when you extend the arm, your finger should actually be midway between that of the examiner and the subject. And then the examiner wiggles the index finger towards the center until it is just visible to the examiner. So see, this is how the examiner should wiggle the hand. Okay. And you ask the subject whether he can see that wiggling finger or the moving finger. Now we have to repeat this procedure in all four directions, all four quadrants, that is the upper left, upper right, lower left and lower right in an oblique direction. So basically you have to move like an X. Now there are certain books which tell that you can actually continue till the center of the field, because we want to rule out if there is any central scotoma. So either way, you can you can move your wiggling finger in all directions, particularly in an X fashion or a plus fashion, so that you can know whether all directions of the visual field is normal or not. Okay. Similarly, you have to test the other eye also. So see, when you're testing the other eye, you can see that the subject and the examiner are going to cover the corresponding eye, and then you're going to examine. Okay. And one more thing is, when you're testing the nasal side, the examiner has to actually exchange his hand, because you don't want to cross in the midline. So that is one thing which you have to learn directly by trying to do it on your friends or on any other subject. Okay, you have to actually do this and practice it, otherwise it will be confusing. So that is the confrontation test for visual field. Next is color vision. So how will we test for color vision? So for that we've got another chart which is called the Ishihara's chart. So basically color vision is the ability to distinguish between different colors, and using this Ishihara's chart you can ask the subject to read these letters. So if this is a person who's got a red green color blindness, the person will not be able to read this number which is written here, which is 74. Okay, so like that you can test for color vision. So that will complete the optic nerve. So wherein we have discussed about the visual acuity, visual field and color vision. So 3 points in optic nerve: visual acuity, visual field and color vision. In visual acuity we had distant vision and near vision. Okay. So now we'll move on to the next cranial nerve, which is 3, 4, 6 cranial nerve. So why are we testing all the three together? Because all the three cranial nerves are involved in the regulation of extraocular muscles. Remember, you must have studied a code for in anatomy, SO4 elastics. That means superior oblique is by cranial nerve 4, lateral rectus is by cranial nerve 6, and all others by the third cranial nerve, which is oculomotor. So all the three cranial nerves are involved with movements of the eyeball, and that is why we're going to test them together. So first we'll see how you can test for the movements of the eyeball. So for that you can ask the subject to remain seated while the examiner will hold his index finger at about 50 cm in front of the subject's eye, like this. You have to fix the patient's head. That means you can, with the other hand, you can actually hold the head, or you can ask the subject not to move the head, and then you move the finger. The examiner will move the finger in a H-like pattern. Okay, so see, from the midline, your finger has to go like this, and at that point you have to go up, then go down, and then return to the horizontal line, move on to the opposite direction, move up and move down. Okay, so that is how you'll test for movements of the eyeball. Remember, this also you have to practice, otherwise you will get confused when you reach the examination hall. Now the next thing we have to test for in 346 cranial nerve is whether there is any strabismus, nystagmus or ptosis. So first we'll see what strabismus is. What is strabismus? Strabismus or squint is a condition in which the visual axes do not meet at the point of fixation. So see, as shown in the picture, this is called squint or strabismus. So to test that, you can sit directly facing the subject around 1 meter away. Look for any abnormal head posture such as head tilt, and then you can shine a torch directly in front of the subject, and then see whether you can ask the subject to look directly onto the eye and observe the reflection of the light on the cornea in relation to the pupil. So see, for this person you can see that these two small white dots are the reflection of the torchlight which is being held, and then you compare that reflection with the pupil. So for this eye, suppose it's at the center of the pupil, you can see that for this side it is more towards one side, which means that there is a slight squint or strabismus. Okay, so that is how you will test for squint. Now next, what is nystagmus? So nystagmus is an involuntary conjugate, often rhythmical oscillation of the eye. So see, as you can see, there is this rhythmic oscillation of the eye which is called the nystagmus. So how do we test for that? For that, you can hold your finger at an arm length away at the level of the subject's eye, and then you instruct the subject to focus on and follow the tip of your finger, just like you examine for movements of the eyeball. And then you slowly move your finger from side to side and up and down. We should not move more than 30 degrees from the primary position of the gaze, because there will be physiological nystagmus at extremes. There can be physiological nystagmus at extremes of gaze. So here we are just moving your finger and just observing whether the subject eyes has got any oscillations or abnormal movements. So that is how you can test for nystagmus. So remember, for nystagmus, the test is similar to that of your movements of the eyeball. And finally, you have to see whether there is any ptosis. What is ptosis? Drooping of upper eyelid. So as shown in this figure, you can see that here he's got a drooping of one eyelid. Okay, so that is how you will test for strabismus, nystagmus and ptosis. Usually the examiners will not may not ask individually, because this is more of an abnormal condition, but still it's good to know how to test each of these. Okay. Now next, examination of pupils. So when we examine the pupil, which is the pupil here, this is this black hole here, that is called the pupil. So we have to test for the size as well as the shape. So for size, we have to compare the size of pupil under good natural illumination, and normally it is of equal size. And then you have to test the shape also. So normally the shape here for humans, it is circular. So we have to see whether it is circular or not, and also we have to see if there are any irregular contours in the pupil shape, whether there is any abnormality in the pupil shape and compared to the other eye. So that will complete examination of pupil. Now the most important one is the pupillary reflexes. So what are the different pupillary reflexes? So we've got two type of reflexes. One is the light reflex and other is the accommodation reflex. So we've got light reflex and accommodation reflex. In light reflex itself, we've got a direct light reflex and an indirect light reflex. So this is very important. We've got two pupillary reflexes. One is light reflex and other is accommodation reflex. In light reflex, we've got direct light reflex and indirect light reflex. So we'll see how to test each one of them. So first we'll see about the direct light reflex. To examine for the direct light reflex, we ask the subject to sit down and ask them to look at a distant object. So look at a faraway object, and then we bring a torch or a pen torch from the side of the face and then shine on to the eye. See, we're not directly poking the light onto the eyes, because that will in turn cause a Menis reflex. So slowly we are bringing it from the side of the face and then shining onto the eye. And what are we going to observe? We are going to observe for the constriction of the pupil. Now remember, we have to test it on both the eyes. So here we have to, on both sides, we have to bring the torch from the side and then shine directly onto the eye and observe for the constriction of the pupil. So that is how you will test for direct light reflex. Now what about indirect light reflex? To test for the indirect light reflex, we ask the subject to look at a distant object, and then we are going to ask the subject to make a partition in front of their nose, so that the light which is shown onto one eye will not fall into the other eye. So indirect light reflex means when you shine light onto one eye, there should be constriction of the pupil of the other eye. See, directly there is no light that is falling onto this eye, but there should be constriction of pupil. So that is indirect light reflex. That is why we are asking the subject to make a partition in between. Okay, so to do this test, we shine the light onto one eye and then observe the other eye for constriction of the pupil. So similarly, we'll repeat the procedure for the other eye also. So that is how we'll test for the indirect light reflex. So here we should also have a slight theory knowledge about the light reflex pathway. So basically, when light is shown onto one eye, the rods and cones will be activated, and then you already know the visual pathway. So the information is passed on to the optic chiasm, reaches the optic tract, and from there are fibers that go on to the pretectal nucleus, from the pretectal nucleus to the Edinger-Westphal nucleus, and from the Edinger-Westphal nucleus to cranial nerve 3, and reaches the short ciliary nerve, which is going to cause constriction of the pupil. So see, you can see that both when light falls on one eye, both the short ciliary nerves are being activated. That is why there is constriction of pupil on both sides. So this is the basis for light reflex. Now the next pupillary reflex that we have to learn about is the accommodation reflex. So how do we test for the accommodation reflex? So to test that, first of all, we should know what accommodation reflex is. It is a process by which eye adapts to near vision, which means your eye can equally see a faraway object as well as a near object. Okay, so how is that possible? Because the eye adapts according to the distance of the object. So what are the different adaptations or changes that occur? There will be convergence of the eyeball, constriction of the pupil, and increase in the curvature of the lens. So I usually remember this as the 3 C's. What are the 3 C's? Convergence, constriction, curvature. So these are the 3 changes that occur during accommodation reflex. So to test for the accommodation reflex, you can ask the subject first to look at a distant object and then suddenly shift the gaze to a finger which is kept just in front of the nose. So here you can see that initially this was the eyes when the person was looking at a distant object. Now when he is looking at a near object, you can see that there is constriction of the pupil, there is increased curvature as well as convergence of the eyeball. So that is accommodation reflex. Thus we've completed the examination of the 3, 4, 6 cranial nerves. We first saw about the movement of the eyeball, then about strabismus, nystagmus and ptosis, then how to examine for the pupils and pupillary reflexes. Okay. So the next cranial nerve that we have to test is the trigeminal nerve, which is the 5th cranial nerve. So we know trigeminal nerve has got sensory as well as motor action. So we will see how to test each. So test for the sensory functions. So we know that the sensory distribution of the trigeminal nerve is through its 3 divisions, which is the ophthalmic, maxillary and mandibular divisions. So when we have to test the sensory part of trigeminal nerve, we have to test all the 3 divisions. Okay. So we have to test for the general sensations like fine touch, crude touch, temperature and pain on the face on both sides. So see, first you have to test the ophthalmic, then maxillary, and then mandibular. So here using a wisp of cotton you can test the fine touch. Similarly for crude touch you can use a blunt object. For temperature you can use the thermoceichometer or any temperature testing device. And for pain you can use the algometer or any other a fine pen or any such device which is used to test for the pain. So remember you have to do it on all the divisions of the trigeminal nerve. Next we have to test for the motor functions. So what is the motor supply of the trigeminal nerve? It is the muscles of mastication. What are the muscles of mastication? We've got temporalis, masseter, medial and lateral pterygoids mainly. So how do we test for each of them? So to test for the temporalis, you can ask the subject to clench the teeth. Okay, you can ask the subject to clench the teeth, and we palpate the temporalis muscle on both sides. So it is somewhere here. So you can palpate the temporalis muscle on both sides. So it will be more prominent when you clench the teeth. The next muscle of mastication is the masseter. So to test for the masseter, again you can ask the subject to clench the teeth and you palpate for the masseter muscle on both the sides. And finally, we've got the lateral and the medial pterygoids. So the lateral and medial pterygoids is meant for opening of the mouth. So you can ask the subject to open the mouth, observe for any deviation of the jaw, and also you can ask the subject to move the jaw sideways against resistance of the hand. So that is how you test for the muscles of mastication. And finally, you have to test for the reflexes also. So we know that the trigeminal nerve is involved in the corneal and conjunctival reflex. These are reflexes basically in which we test the cornea or the conjunctiva depending on which reflex it is, and it will cause reflex closure of both the eyes. Okay. So that is how we will test for the corneal and conjunctival reflex. And finally, we have to test for the jaw jerk. So to test the jaw jerk, you ask the subject to slightly open the mouth, and then we strike on the space which is between the lower lip and the chin by keeping your finger and striking with a hammer or directly percussing on that area. So that is how we'll test for jaw jerk. I've explained corneal, conjunctival and jaw jerk separately in the examination of reflexes video. So if you have any doubts, you can go check that. So that will complete the trigeminal nerve examination, the sensory part, the motor part and the reflexes. So thus in this video we have seen how to examine for the olfactory nerve, the optic nerve, in which we studied about the three points: visual acuity, visual field and color vision. And then we examined for all the three, 4, 6 cranial nerves together. We checked for the movements of the eyeball and all. And then finally about the trigeminal nerve. So that completes examination of cranial nerves 1 to 6. So I hope this is useful for you. Thank you.